Hi folks, Lesley here, let me just start off by wishing everyone all the very best for 2021. May it be a wonderful year. Welcome back to those of you that have been watching my little video clips since around the middle of 2020. And for those of you that don't know me from before, I'm an occupational therapist that facilitates workshops and webinars on various mental health matters in the workplace. I'm here today, in fact, to give you, let's call it a sneak preview on one of these, namely understanding and managing mental illness in the workplace, or as referred to by some of my clients, Mental Illness 101. So let me just start off with a little bit of the content that you can expect in this webinar. I start off by just clarifying the difference between mental illness and neurological illness, because my experience is that these two disciplines of medicine are often confused, as are the roles of the psychiatrist and the neurologist. So I'll give you a little bit of info so that becomes less of a complicated issue. And then we talk about the various different types of mental illness, and I think it's fair to say that everyone, or I'm sure almost everyone, has heard of depression and anxiety, but not everyone understands that these types of conditions present with a diversity of causes and symptoms and different diagnoses as well. So for example, a generalized anxiety disorder is very different to a phobia, which is also a type of anxiety disorder. And a panic disorder is not diagnosed simply on the grounds of one panic attack. So I go into quite a lot of detail about the different types of mental illness. I also talk a fair amount about the misconceptions and the stigma. And at this point, let me just ask you a question. If you've ever thought of someone who suffers from depression as being lazy or unmotivated, especially at work, and if you have, then I'm sure it's going to come as a bit of a surprise to you when I say that getting out of bed in the morning for someone who suffers from a severe depressive disorder can be just about as difficult as standing up is for a paraplegic. And I often use analogies to physical conditions in my webinars, because I think it just makes it a bit easier for people to understand the serious effect that mental illness can have on a person's functioning. I don't only talk about the depressive and anxiety disorders in this webinar. I also talk about the other three of what I refer to as the big five, and those are bipolar disorder, schizophrenia, and post-traumatic stress disorder. So I'll give you quite a lot of insight into what these mental illnesses are all about. My experience in life and in the work that I do is that most people believe that psychiatrists simply talk to their patients for an hour or so, and at the end of that they come up with a diagnosis. Some people, I would even go as far as to say that some people think that the diagnosis is little more than a thumb suck. But let me tell you that it's a great deal more complex than that. Psychiatrists work with a manual known as the DSM, which is currently on its 5th edition. And there are almost 300 different mental illnesses in this manual. And coming up with the right diagnosis is absolutely critical in ensuring that the correct treatment is prescribed, and therefore that the best outcome is achieved for the patient. And this is why I always say that if someone is suffering from a mental illness, they should see a specialist, because it's a complicated business. So I talk quite a lot in the webinar about how the diagnosis is reached. I also talk about reasonable accommodation. You may have heard the term. It's most often associated with people who have physical conditions, and For example, people in wheelchairs need the accommodation of ramps and special parking bays, but when it comes to mental illness, there's also a number of reasonable accommodations that can be implemented in the workplace to allow the person to stay at work and to be optimally productive. So we talk about those, and that assists often in the management of people in the workplace, people with mental illness. So if you're a working person, either an employer or an employee, and you'd like to know more about mental illness and how to manage it in your workplace, then this webinar may well be for you. I'll be running a few public ones in the near future throughout the year, but also if there are 10 or more people at your organization that might be interested in attending, then I will run a workshop, a webinar virtually for your team, or even come into your office if people are back at work. And let me just end by saying, if you want to know a little bit more about me and what I do and how I do things, then please feel free to go onto my Facebook page or my YouTube channel. There are, I think, 17 videos there. Have a look and get in touch if you're interested. All right. All the best. Bye for now.